Welcome back to Harmonize Your Life, conversations on self-care for women of color with your host, Dr. Toni G. Alvarado. You know, we are in our May series. It is a celebration of motherhood. And I could not think of any better organization to highlight and woman to conversate with on today than our guest. I want to read her bio and share a little bit about our guest for today, and then we'll jump into our conversation. So, I am talking today with the president of Black Women's Health Imperative, Linda Goler Blount. Linda Goler Blount joined the Black Women's Health Imperative as the president and chief executive officer in February 2014. Linda leads BWHI strategic direction and is responsible for propelling the organization toward achieving its mission of leading efforts to solve the most pressing health issues that affect Black women and girls in the United States. Before joining BWHI, Linda served as the vice president of programmatic impact for the United Way of Greater Atlanta, where she led the effort to eliminate inequalities in health income, education, and housing through place and population-based work. Prior to that position, Linda was the first ever national vice president of health disparities at the American Cancer Society. There, she was responsible for providing the strategic vision and leadership to the society and its 12 geographic divisions to reduce cancer incidences and mortality among underserved populations and to develop a nationwide equity policy. With more than 25 years of experience in the public, for profit, and nonprofit sectors, Linda has a distinguished career that includes successful tenures at the Coca-Cola Company, leading strategic business initiatives, and the U.S. Centers for Disease Control and Prevention as an expert scientist. She also has extensive international health expertise as a consultant to government ministries in Germany, South Africa, Zimbabwe, Malawi, Jamaica, and Trinidad and Tobago, where she lived for 4 years. Linda is a prominent speaker and member of the American Public Health Association and the National Association of Health Services executives. She serves on the Community Health Charities Board, the University of Michigan School of Public Health Summer Enrichment Program Board, and is past chair of the University of Michigan School of Public Health Alumni Board of Governors. She previously served at the Emory University Center for Ethics Advisory Board and the Morehouse School of Medicine Public Health Program Advisory Committee. A Michigan native, Linda holds a Master of Public Health degree in epidemiology from the University of Michigan and a Bachelor of Science in Computer Engineering Operations Research from Eastern Michigan University. Linda, before you talk, I want to just tell you this. My husband will forgive you from being from Michigan since he is from the state of Ohio, particularly Columbus, Ohio. So you know the rivalry between Ohio State and Michigan.
I do, Dr. Tony, and all I have to say is God loves everybody,
Yes, he does.
even people from Ohio.
Even people from Ohio. So I want to welcome you to the Harmonize Your Life podcast, Linda. Thank you for being here with us on today. Thank you, thank you, thank you.
Oh, thank you so much for having me. It's a real honor, and anything we women can do to harmonize our lives, we need to do. So thank you for doing this.
Yes, thank you. So, Linda, I met you last year at the retreat that's hosted by our sisters, our friends, Shauna Francis Watley, and Dr. Kimberly Alexander, and who happened to be a guest on on our podcast for the month of April. And so they were sharing, we were sharing as on our podcast conversation about self care for first ladies, because all of us are married to bishops and pastors, and also doing the work that we do in empowering women. And we just talk. But I had the opportunity to hear you last year at their retreat, at the Rejuvenate retreat. And oh my God, the conversation that you led on the issues, the health issues that are impacting African American women, and particularly this issue that we're going to talk about today on maternal mortality. It just left an impression in my heart. And I knew then that eventually you and I would connect. And so I'm so grateful that in God's time that we have connected today for this very critical conversation on maternal mortality. Thank you again. So I want to begin by asking you to explain for our audience, what is maternal mortality?
Okay. Well, thank you again. And this is a really critical issue for Black American women. And I'm so glad that we're able to have this conversation. So, maternal mortality is women who die during or around or just after childbirth. And the way the Centers for Disease Control defines it is it's a death from a non-accidental cause. So if the woman is pregnant and she gets in a car accident and dies, that's not considered maternal mortality.
Mm-hmm.
It's it's from a non-accidental cause that occurs during pregnancy or within a year of the termination of a pregnancy. So
Mm-hmm.
whether she lost the baby or delivers the baby, if she dies within a year, that's considered maternal mortality so long as it wasn't from an accidental or an injury
Mm-hmm.
kind of cause. And with Black American women, it's occurring at alarmingly high rates. And we have to do everything we can to prevent this.
Wow. And what's amazing to me is, Linda, I really was not aware. I started hearing more about it after the retreat last year, after I heard you lead the discussion on it. But as an African American woman who's had three children, who's raised three children, two births and one adoption, two cesarean births, um, and at 57, almost 57 years old, I was unaware of the rate in which African American women were dying in childbirth or a year after childbirth. And so when I say this conversation needs to be had, it really needs to be had. Awareness needs to be raised in our community concerning this issue. And so that was one of the reasons why I knew I had to have you on our podcast series this month, because this being a celebration of motherhood. And I know if I was unaware, there's so many others in our community that are unaware of this issue. So, what are some of the key issues for Black women, and why are we dying in such high rates?
Well, first we have to look at what's happening in the country. The United States, despite spending twice as much on medical care as the next nearest country, Switzerland, has significantly higher mortality rates than every other country, and maternal mortality rates in particular. The United States leads. And if you look at the last 20, 25 years, there's been a steady increase in maternal mortality
Wow.
among all women in the United States, where if you look at every other country, the rates have declined in the last 20 years. So, there was a former chief, the head of maternal affairs for the United Nations, or WHO, basically said, this is happening in societies where not because we don't know what to do, but because women are viewed as not worth saving. And so it
Oh.
shows how women
Mm,
in the United States are not prioritized. But when you look at Black women,
mm.
so while maternal mortality has been increasing for everyone, Black women have 4 times the maternal mortality rate of white women.
Wow. Wait a minute.
And
I want to stop you for a second, because I don't want these some of the things you're saying here are worth capturing, and actually worth digging deeper on. So you said, number one, women in general are not worth saving in the view in our culture.
If you look at how we are treated, if you look at the images, if you look at the news, television, social media, you can see the consistent devaluing of women,
Mm-hmm.
and particularly the devaluing of Black women, as we're perceived as, hypersexual,
Mm-hmm.
as irresponsible about our
Mm-hmm.
health,
Mm-hmm.
as not caring about our children. You know how we get portrayed in the
Mm-hmm.
media,
Exactly.
and nothing could be further from the truth. But for people who don't think carefully about this sort of thing,
Mm-hmm.
they're led to believe, and I must admit, some of my public health colleagues are guilty, that the reason we're overweight or the reason we have diabetes or
Mm-hmm.
whatever it is because we're Black. And that is not the case at all.
It's not.
That is not why it's happening, but it is when you devalue a whole population, when they don't have access to fresh fruits and vegetables, to good quality health care, when these things we call the social determinants of health, when they are restricted or limited,
Mm-hmm.
then you do the best you can. But if you can't do anything better, then
Mm-hmm.
you're going to suffer the consequences of those limited of the limited access. And frankly, when you look at this country, we're talking generational oppression of Black and brown women in particular.
Generational oppression of Black and brown women. You talked about social determinants of health, like food deserts,
Hmm.
um,
Yeah, poor
the
housing.
poor housing. Yeah, 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 and
Yeah,
economics.
yeah. And well, then you look at policy. I mean, every other developed country has family leave. A woman gives birth, she can stay home for months, in some
Yes.
countries a year, to
Mm-hmm.
bond with her baby, to get used to being this mom, to manage her life. In this country, if you get it at all, you're coming back at 6 weeks. Now, if you're an executive, sure, you can have a longer time.
Mm-hmm.
But Toni, if you look at the workers who've been laid off recently as a part of COVID 19,
Mm-hmm.
80% of them have no maternity leave.
Exactly. You're so right.
And,
You're so
they
right.
have to make do, or those that do have it, they have 6 weeks. You've had children. Were you ready to go back to work at 6 weeks?
No, ma'am.
Full time, full
No,
bore?
no,
No, of
no,
course not.
no. And fortunately for me, I was able to, because I was in a position at that point in my life to take the time that I needed,
Hmm.
to bond with my children and to be home and to really physically, emotionally, mentally, all of that stuff recover. And yes, you're right. When you talk about this COVID-19 thing and the whole sheltering in, I think it was Charles Blow that did an article
Hmm.
recently that talked about sheltering in place and social distancing is for the
Yep,
privileged. I mean, but
absolutely it is.
if you, everybody, and when we talk about why we're dying at higher rates, even with the coronavirus, and in the conversation of stay home, everybody don't have the privilege of staying home. Most people, a lot of them don't even have a home to stay in.
Well, right, there's that. But then if you're that worker, the home health aide, the hospital worker, the bus driver, I mean,
Mm-hmm.
the cashier at the
Mm-hmm.
grocery store,
Mm-hmm.
these are jobs that are considered essential. They
Mm-hmm.
are they are overrepresented by Black people and people of color. So
Mm-hmm.
these are the brave men and women, and I'm going
Mm-hmm.
to say women because a
Yes,
lot of these jobs are
our
held by
women.
women. These are
Mm-hmm.
the brave sisters who are getting out every single day on the bus, on the subway, facing customers. They have no idea what these customers have been exposed to,
Say it,
but they
Linda.
are bravely showing up every single day to take care of patients, to take care of the hospital needs, to take care of us as we go shop at our grocery
Yes,
stores.
yes, yes. So
And
that we
they are
can have,
putting themselves in
yeah,
harm's way so that we can live our lives. Those of us who
yeah,
have the privilege, as you say, of working from home,
yeah.
they can't. They can't
Wow.
work from home. And I just want to thank them and honor them. But also, Dr. Tony, some of these women are pregnant,
Yeah.
you know,
Wow. Wow. And
and they still go into work.
I haven't even thought about that when it as relates to where we are right now with the COVID-19.
Hmm.
I've thought about the homeless and I've thought about uh just our essential workers, but
Hmm.
it had not dawned on me until you just said it. Some of these women, which a big part of this workforce, this essential workforce, are women, and
Hmm.
some of them are pregnant.
Yeah.
They're
And
carrying that
terrified.
life and
Yeah.
terrified. Wow, 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 wow. Oh my Lord. So we know that there are maternal health disparities. But how do we know about data collection or the lack of collection? How do we get this information?
Yeah, that's one of the things that makes this so tough. You talked about sort of learning more about this in the last year. The disparities in maternal mortality have been going on for a very long time. This didn't just happen. What happened is we had a very high profile person nearly lose her life with Serena,
Mm-hmm.
and a couple of very high profile women, Kira Johnson, Shalone Irving,
Mm-hmm.
who sadly, tragically lost their lives.
Yeah.
And it was when we had these terrible losses that the medical and public health community said, "Oh, wait a minute, what?" And then the media got a hold of it and said, "Wait,
Mm-hmm.
what's
Mm-hmm.
going on?" But
Mm-hmm.
in fact, this has been happening for a long time.
Mm-hmm.
We have at the hospitals something called maternal mortality review committees, where
Mm-hmm.
when a woman dies, in childbirth or
Mm-hmm.
just after, the data are supposed to be collected and then analyzed as a group so that hospitals can understand what happened, what
Mm-hmm.
caused this.
Mm-hmm.
Well, only 29 states have these maternal mortality review committees at their hospitals.
Mm-hmm. Mm-hmm.
And of the 29, not all of them actually examine the data. So while we know that Black women are dying at much higher rates, there hasn't been a thorough examination by state of why this is happening. What we
Mm-hmm.
hear is, well, it's because they have higher rates of gestational diabetes
Mm-hmm. Mm-hmm.
or obesity,
Mm-hmm.
higher complications,
Mm-hmm.
which are true. But then one has to ask oneself, well, why is that? Why
Mm-hmm.
do Black women have higher rates of diabetes and obesity? And when we look at that, when we talk about these social determinants, we come back to the policies that keep women again from making the kinds of healthy choices that we'd like to make, this
Mm-hmm.
this oppression. So
Yeah.
if you don't have access to healthy fruits and vegetables, you're going to eat what you can eat.
Right.
And if you have no money, that means you're going to eat high sugar, high carbohydrate kinds of foods, and you're going to feed your family. I
Right.
mean, that's
Right.
we're going
Right.
to take care of our families. But then that leads to obesity and the resulting chronic diseases. But the other thing that I want to mention, because it's so important,
Mm-hmm.
is the role of stress. Because what I
Okay.
hear is, well,
Okay.
why don't women just eat more healthy and exercise, and all that's fine if you have the privilege to do that.
Mm-hmm.
But this isn't just a low income issue.
Okay.
As you know, many of our middle and upper middle class sisters also have these same issues. And I'll just point out that maternal mortality and infant mortality rates are higher for highly educated, high income earning Black women than for white women without an eighth grade education. So this isn't just an issue of poverty, but
But
what
it's
we've seen now is
the role
stress.
of stress. Okay.
We know Black women have higher cortisol levels than white
Mm-hmm.
women,
Mm-hmm.
and that leads to literally changes in how we metabolize food. So if
Mm-hmm.
you give Black women and white women the same high fat diet, Black women will gain more weight and gain it faster.
Mm-hmm.
If you give us the same low fat diet, we'll lose less weight and lose it more slowly. And we see what it does to our inflammatory
Yeah.
response, which is
Yeah.
why we have higher rates of chronic disease. So this isn't an issue of self-control, because I would say if anybody on this planet has self-control, it's Black women.
Yeah, yeah, yeah. I know for me, even with my thyroid condition, it was stress related. When I
Hmm.
was diagnosed with Graves' disease, which is really what got me on this whole self care journey several years ago in 2003 and 2004, when I was diagnosed with Graves' disease, and
Hmm.
it was really stress level. And here's the thing, I wasn't. It wasn't. I wasn't low income at that time. I mean, I have been low income, but at that time I wasn't. And I'm married, and but I was doing ministry. Our church was flourishing and doing 2 and 3 services a Sunday. I was traveling. My That was around the time when my itinerant ministry really started to pick up. I was in school, earning degrees, but my stress level was so high,
Hmm.
and that was when I was diagnosed with with um, with Graves' disease. And to be honest with you, I started having children later, as as some would say in life, I had my first son when I was 34. And then my daughter, my two births were at age 34 and 36. Now our middle
Mm-hmm.
son was adopted in between those two births. But um i but yeah, so I'm sure my stress level was high even when I was carrying them. As a matter of fact,
Sure.
when I was pregnant with my son, I went into we had to have an emergency C-section with the oldest son,
Mm,
because while I was giving birth to him, I labored for 18 hours. While I was giving birth, the umbilical cord began to wrap around his neck,
mm,
and he started losing oxygen, and so they saw that he was in trouble, and so they literally they told me, hey, we gonna have to take her into an emergency C-section. Thanks be to God, he we came through that. He was born through
mm.
C-section, and I bounced back from that. And then when I had my daughter, my second birth, um, she I had to go into C-section with her. It had to be planned. They didn't even want me to try going through
Uh,
labor with her. So hers was a planned C-section. But and I remember after her going through postpartum depression
mm-hmm.
and all of that. And so it having gone through that experience, but not even really knowing what risk I was really in, what risk category
Right.
my life and
Right.
my baby's lives were really in. So I'm thankful for the grace of God that covered me during that time, because I mean, we perish for the lack of knowledge,
Yes.
and I didn't
Yep.
even have this knowledge. So, but I'm concerned. My daughter is 21, will be 21 this year, and my daughter-in-law will be 23 tomorrow. And I pastor women who are in having babies, and so I really wanted to bring this conversation to the forefront because it's been on the back burner, and we need to know what we can
It,
do.
it, you are so right. And I have to say, you had an emergency C-section. So I would imagine that was in your brain, even with your daughter, with your second birth.
Yes,
You
yes,
things might have been fine, but you were thinking about it.
yes.
And this is what concerns me, because you talked about, you might have been depressed. You probably weren't diagnosed. Black
No,
women
I wasn't.
probably have higher rates of postpartum depression, but we are much less likely to have it diagnosed and certainly less likely to have it treated, because doctors don't ever even think about it. They don't. They kind of have this. Again, it's oppression, it's media, it's racism. Oh, black women, they just
Mm-hmm.
have babies and we're
Mm-hmm.
never affected by it.
Mm-hmm.
Yes, we are.
Mm-hmm.
And what really concerns me is, if I'm a black woman now and I was pregnant, I would be terrified knowing I've got to
Mm-hmm.
go to a hospital and
Mm-hmm.
deliver and I might be exposed to COVID
COVID-19.
19.
Yes.
I would be
Yes.
terrified.
Yes.
And
I can't
I'm
imagine.
like you. My daughter has got married 2 years ago, and so I know they want to start having a family. With what I know about Black maternal mortality and now COVID-19, I'm gonna try to keep my fears to myself
I
and
hear
not
you.
make her crazy. But I'm gonna be nervous
Yes.
through this whole
Yes.
process.
Yes. Yes. I mean, I'm thinking about it, especially now that I have the possibility of a grandchild coming, and my daughter-in-law, knock on wood, is not pregnant. To my knowledge, my son, who's an engineer right now, is shaking his head. Her husband, but they do want to have children, and we want them to. But
Yes.
to hear and to think about this, and then I have girls in my church, women that I mentor, and just our society and our culture in general. And so that's why I felt like in this podcast conversation, we needed to bring this conversation to the fore. What are some things that our women can do to help? What can we do as a community? What are some things that we can do?
Oh, well, you know, first of all, we one of the things we do is, we take care of ourselves. So,
Mm-hmm.
as best we can, eat as healthy as we can, get exercise, reduce our stress. I would put that number one. If we can just reduce our stress,
Reduce our
that would be
stress.
that would be
Mm-hmm.
helpful.
Mm-hmm.
Um, but be prepared. Have the connection. Talk to people. Have your birth team. I don't just mean, your OB and
Mm-hmm.
nurse, but have those sister friends, your relatives around you who are all cheering for you and saying, we're supporting you and we want to help you, especially now, because if
Mm-hmm.
you go into the hospital now, Most hospitals are allowing you to have one person there for the delivery and then they have to leave. Some hospitals are actually at requiring women to labor and deliver alone, and I can't even
Oh
imagine
my God.
what that would
I
be
can't
like.
even imagine that.
So have your folks around you. But, what I think we can do is one of the things that the Black Women's Health Imperative that we're going to roll out is something called a birth plan, where you've got
Okay.
everything written out. Here's what I expect. Here's what I need.
Okay.
Doctor, you're doing this.
Mm-hmm.
These people are going to be helping me. And so that everybody's clear, because
Mm-hmm.
part of what happened with some of these tragic losses is the doctors didn't listen to the
Right.
women.
Right.
Each of these three women
Mm,
knew something is not right. They
something's
went back
wrong.
to the doctor. I
Mm-hmm.
don't feel right. It's you write it out. When I say I don't feel right, here's what you're going to do so that you don't have to worry about that. And then
Mm-hmm.
and then we say we want you to know your numbers. And I don't mean blood pressure and A1C level.
Mm-hmm.
I mean know the number to the chief of the hospital, the
Okay.
CEO, the
Okay.
board chair, if you the newspaper editor, because if things go wrong, you want to make sure people
Okay.
know about this. So
Okay.
you want to do that. But also, I mean, a lot of this is policy. Yeah. So, for
Mm-hmm.
example, if you're a low income mom and you have Medicaid as your health insurance, it
Mm-hmm.
expires after 6 weeks. Well, that's
Wow.
ridiculous. If the
Mm-hmm.
postpartum period is considered a
Mm-hmm.
year after you
Mm-hmm.
have a baby, how
Mm-hmm.
are you going to terminate my health insurance? So we really do need women to get out there and be advocates, to vote, to make
Yes.
sure that
Thank
we
you.
get people in office who will support Black women's health, who understand what the issues are, and will do things like we need to expand Medicaid and expand Medicaid for postpartum moms to a year, to
Mm-hmm.
cover doulas and midwives.
Yes. Yes.
I'm
Yes.
thinking in this time right
Mm-hmm.
now,
Mm-hmm.
more and more women are going to turn to doulas
Doulas
and
and midwives.
midwives.
As a matter of fact, one of my guests this month, Jada Wright, was a doula,
Hmm.
and a midwife.
Hmm.
And one of the girls in my church, she had both of her babies with a doula at home. And so,
Hmm.
and I was like, girl, let me give you a high five. Let me give you a high five. But listen, but Linda, isn't that the way we had our babies before?
Yes,
When we couldn't go
yes,
to the
it is.
hospital, my
Yes.
grandmother, they had babies at home, you
And the
know?
data show that babies born at home under the care of doulas and midwives do just as well, and in many instances, mom and
Better.
baby do better.
Better.
Because
Mm-hmm.
hospitals can be very dangerous places to be, but we need to get them coverage. We need to make sure that they are
Okay.
reimbursed for their work as
Mm-hmm.
they should be, and
Mm-hmm.
valued by the medical establishment. And the doctors and nurses don't always take doulas and midwives seriously. Some
Exactly.
do,
Mm-hmm.
but not all.
And she talked about that. Jada talked about that in our conversation about how hard it was for her to break into that industry as a midwife.
Hmm.
And she said, now listen, she said that as a black woman, it was very hard, but the white women are there.
Yeah.
They're in
Yeah.
that field, and she said it was
Hmm.
hard to find a mentor for her as an African American woman being a doula and a midwife. And so those of us who are there, we need to look back and reach out and grab our sisters and bring them up in this very, because midwifery is the most ancient profession.
Yeah.
You
Right.
know,
It has worked for thousands of
thousands.
years.
One of my favorite sermons that I preach is out of Exodus chapter 1 with those
Mm.
midwives and Pua and Shifra. And I actually recently at Morehouse, I was asked to speak for Women's History Month, the first Sunday in March. And that's what I preached from Exodus chapter 1. And I talked about where are the midwives? Where are the midwives? And I
Yeah.
had no idea we'd be where we are right now when I preached that message. But yes, and so thank you for being a midwife, Linda,
I'm
and
a big proponent of midwives.
thank you for being, because
Yeah.
doing what this work you're doing, this
Hmm.
is midwifery. This work with Black women's health imperative, this is the work of a midwife. The
Yeah.
information, we perish for
Getting.
the
Hmm.
lack of knowledge. And so the fact that you are bringing this information to us and you're freely giving this information and helping us understand and know how to advocate as women. I wrote down some of the things you said here about the role of stress and postpartum depression understanding. Can you give for just a little bit, so those that may be listening, um, what are some of the signs of postpartum depression? Can you share just one or two things that
Oh,
we could be aware of?
absolutely. So, we've all had days where, we just don't really feel like doing too
Mm-hmm.
much,
Mm-hmm.
just need a break.
Mm-hmm.
But when the new mom doesn't seem excited about her baby, when you watch her look at her baby's face and she doesn't smile and light up,
Mm-hmm.
that's a signal.
Mm-hmm.
When when you're a new mom, if you can get dressed for the day, that's an accomplishment. But when you see the new mom go 2, 3, 4 days without getting dressed, without showering, that's a
Mm-hmm.
sign.
Mm-hmm.
And what we say is, we like, how people are, it's like, well, I don't want to get into your business. We say, absolutely, mind your sister's business. Ask her, so
Wow.
how you doing, sis?
Mind
How
your
you doing?
sister's business.
What
Yeah.
did you do today? Did you
Mm-hmm.
eat?
Mm-hmm.
Did you
Mm-hmm.
feed the children? Well,
Mm-hmm.
what did they do? Ask these questions and listen to what she says and watch what she does and absolutely mind her business. And if it doesn't look right, because we know, Toni, we know if
Mm-hmm.
somebody's feeling right.
Mm-hmm.
And we
Mm-hmm.
know that we will
Mm-hmm.
say, oh, no, I'm doing fine. And we know you're really not.
Mm-hmm.
And
Mm-hmm.
that's when you say, okay, sis, well, here's what I'm seeing. So maybe you should talk to somebody.
Mm-hmm. Mm-hmm. That's
Not,
right.
not accusing her of anything, but this happens and it's a lot right now. And so
Mm-hmm.
why not just have a
Have a
conversation and
conversation. Yes. And
encourage her to talk to, if she's got a therapist, talk
mm-hmm.
to a therapist. If she's got a counselor,
Mm-hmm.
if she's got someone in her health ministry at church or
Mm-hmm.
her institution of faith, just talk to somebody, because that very act of having the conversation, then to that trained person,
Mm-hmm.
they can say, oh, okay, so maybe it's just talk therapy, maybe she might need some medication, maybe she might
Mm-hmm.
need something else. But what we want at the end of the day is for our sisters to have the support that they need to be as healthy as they can and to make sure that their children are as healthy as they can be.
Wow. I love that concept of mind your sister's business.
Hmm.
My organization, My Sister's Keeper Foundation for Women, that's one of our things. We get in each other's Kool-Aid, and
Yeah,
we
yeah,
we
absolutely. You
dig
got to be
deep.
your sister's
You
keeper.
have to
Yes.
be, and you can't be afraid to go there. And she may get mad at you for a minute, but she'll thank you
Hmm.
when it's over. Ladies, are you registered for the Harmonize Your Life Women's Self Care Retreat? I'm so excited. We're going to Aruba January 7th through the 11th, 2021. We're getting ready. We're packing our bags. We are getting ready for the next Harmonize Your Life Women's Self Care Retreat in Aruba. Join me there for a week of reflection, of fun time, creative time with a wonderful group of women as we are putting ourselves at the top of our list at the top of the year for self care in Aruba at the Harmonize Your Life Women's Self Care Retreat. For more information, email me at hello at drtonyalvarado.com. That's hello at drtonyalvarado.com so that you can register for the Harmonize Your Life Women's Self Care Retreat 2021 in Aruba. Meet me there. I appreciate that. And so, on a policy level, I know you talked a little bit about laws and policies and running for office and voting and those things and making sure that we vote for people who are concerned about women's health, number one, and Black women's health and this
Hmm.
issue. But on a policy level, what other things can we do? What can we do to help move the policies along? I know Black Women's Imperative, your organization, and there are others that are concerned. I know Judge Hatchett is on this because of her daughter-in-law, right?
Hmm.
And so, can you tell us at what can we do to help push these policies and make sure that these policies are moving in the favor of Black women and our health in this maternal mortality issue?
Well, to your point, information is everything. There have been a number of bills that have been proposed by various members of Congress, and recently, Representative Lauren Underwood out of Chicago, out of Illinois,
My home
and
girl.
Yep, and Senator Kamala Harris
Mm-hmm.
have come together on a Black maternal health, what they're calling a momnibus bill.
Okay.
And so what they've
Say
done is
that
they've looked
again.
at
Which bill?
it's 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 the Black Maternal Health Momnibus bill. So
Momnibus.
Momnibus, right? You've heard
Mm-hmm.
of omnibus. This is
Mm-hmm.
the Momnibus,
Oh, okay.
and
Uh-huh.
hmm
The
and they've
momnibus
looked
bill.
at a number of the different kinds of legislation that have been proposed, and just basically kind of put them all together. And they've got broad support from the Black Maternal Health Caucus and the Congressional Black Caucus to really look at these issues that are germane to Black women's health, but will help improve maternal and infant health outcomes. So things like, family leave,
Mm-hmm.
and having more than 6 weeks of leave, centering pregnancy models, which have been highly effective,
Mm-hmm.
expanding Medicaid and expanding insurance, child care,
Mm.
um, and giving women, particularly low income women time off to go get their prenatal visits, because a significant number of Black women don't get prenatal visits because their employers won't give them the time off, or they
Wow.
can't make money.
Okay.
The employer says, okay, well, you can take your four
But you're not
hours
getting paid.
but you're
Mm-hmm.
not getting paid,
Mm-hmm.
right?
Mm-hmm.
So to make sure that women don't have to make a choice between putting food on their table and getting their prenatal care.
Wow.
Um, and so if people are aware of that, then they can look at, where elected officials are on these issues,
Okay. So we need
because
to
it
press
provides
them.
funding
Mm-hmm.
to community organizations
Mm-hmm. Mm-hmm.
to expand health insurance. But know where your elected official or your candidate is.
Mm-hmm.
We produced, as you know, um, I guess the year before last, Black Women Vote.
Mm-hmm.
It's
Mm-hmm.
a
Mm-hmm.
national health policy agenda for Black women's health.
Mm-hmm.
And there's a scorecard in the back of it, and it's on our website,
Okay.
bwhi.org. You can download it.
Mm-hmm.
And there's a scorecard for major women's health issues and legislation. So you can see where your elected official is on those issues. And we're going to produce another one this year for this election. So that the people that we put in office from city council on up
Okay. Okay.
understand the importance of Black women's health and are advocating for it. And those who don't, well, you know what to do
Yeah.
with them.
Yeah. I understand.
But these
Wow.
are the issues that are critical
Mm-hmm.
for us to make sure we have the best health outcomes for moms and for our children. Because if the mom doesn't do well, as and you think about Kira's children,
Mm-hmm.
Shalon's daughter,
Mm-hmm.
these children have to grow up without a mother. This is
Mm-hmm.
traumatizing for them.
Mm-hmm. Yeah.
And we see it, how it gets played out in educational
Yeah.
attainment and
Yeah.
behavior, because these kids, they grow up without a mom,
Yeah.
and it traumatizes family members too. And so
Wow.
we want to stop that. There's no biologic or genetic reason why any of this should happen. This is all about how we value women and how we
Mm-hmm.
prioritize Black women in particular.
Wow.
So
Wow.
I appreciate what you are doing. And I just encourage anyone listening to know what the facts are and make sure that the people who are in charge of setting these policies understand what the facts are and behave accordingly.
Well, I tell you, I'm going to use my voice. I'm going to use my whatever platform, my pulpit, to raise this issue even more. I mean, I have been enlightened even today. I learned more today even than I did last year, and listening to the um to the panel discussion that you led on this. And I mean, my baby is leaping inside of me, metaphorically, because I'm not pregnant. But I'm just, there's something in me that's just being drawn to this right now. I almost want to cry because I'm just sensing by the Spirit that there's more work that even God is calling me to do in this area. And so I want to connect with you even after this conversation, to see what other work I can help you with, help to move this agenda along, how I can serve in this way, not just with the podcast, but even with my Sisters Keeper Foundation. I'm connected
Mm-hmm.
to several organizations, my own church, women's ministry, as well as My Sister's Keeper, which is the foundation that I founded and I'm the executive director of. I'm connected with the Women of Color Empowerment Institute, and of course, I am a member of Alpha Kappa Alpha sorority. I serve on the health committee. One of our targets in our sorority is women's health, and so I
Hmm.
would love to be able to connect some of the other organizations that I'm a part with the Black Women's Health Imperative, and see how we can work together because we can't do this alone.
No, we need each other.
We need
We
each
need each
other.
other. And I'll tell you, the Black Women's Health Imperative, I mean, we've worked with a lot of these organizations, and we stand ready to do everything we can to help continue the good work
Hmm.
that you're doing and others are doing, because we need to do this.
We have to.
We are too valuable to
Hmm.
see this happen, and not another mother or sister or brother should lose a woman in the family to maternal mortality. It's
Wow.
just not necessary,
Not
and
one
we've
more.
got to put a stop to it.
We
Not one
have to.
more.
Amen. Wow. Thank you, Linda. I mean, this conversation is just been most enlightening for me and most enjoyable. Um, will you give us one more time the website to the Black Women's Health Imperative?
Absolutely. It's bwhi.org.
bwhi.org. If you're listening, please write that down. Go there, get that scorecard. Let's see what our elected officials see who's pushing this. She's already told us that Lauren Underwood and Kamala Harris, Senator Kamala Harris, and Laura Underwood, Congresswoman Underwood, they are pushing this bill, the Momnibus bill. We need to make sure that in our communities, from our county officials on up, are concerned about women's health and particularly Black women's health and this issue of Black women and maternal mortality. We don't need to lose one more mom to this issue, and I believe we can do something about this at the very grassroots level, all the way up to the policies that shape how we are having our children. And so, again, Linda, I thank you. Thank you for giving me just a little moment of your Saturday so that we can have this conversation and move this agenda along. I look forward to connecting with you even further.
Well, thank you, Dr. Tony, for all that you're doing, for doing this. This is so important. And please be safe and be well.
Same to you. As soon as we come out of this COVID, this pandemic, we will get together over a over a meal and continue this conversation, but not just talking about it. We're gonna put some. We're gonna get some action going so we can move this thing along.
Absolutely. I'm looking forward to it.
I am so delighted about bringing the Harmonize Your Life podcast to you. Would you do me a favor? If you are enjoying this podcast, would you email me at hello@drtonyalvarado.com? I want to hear from you. I want your feedback. I want to know if there are any other topics that you are interested in as it relates to wellness, self-care, nutrition, or just overall bringing harmony into your life. Email me, contact me at hello@drtonyalvarado.com.